Well, I'm going to talk on similar topics. I'm jumping ahead here. And as Angela mentioned, there are safety protocols in place throughout the BCH system, including the hospital in all areas, including surgery, cardiology, radiology, the lab, mammography, all the imaging centers, and as well as some of the other BCH facilities. And as Angela mentioned, at Erie, they're obviously doing a very good job of keeping track of folks and keeping everybody safe. So this is what Angela described is really a protocol that exists throughout the system. And so we're really proud of that we're able to offer safe and effective care by practicing these safe methods. We do have people that are sitting in our waiting room. We also have some folks, here we go. Some people prefer to wait in their car, and that's perfectly acceptable too. And then we just call you on your cell phone when it's time to come in. Fortunately, this is probably getting maybe a little less common just because there's so much space in the waiting rooms, and the new protocols have really kept people safe. But this is always an option if you're specifically concerned. Everybody who comes through the door is screened by questionnaire, by temperature, as Angela mentioned, and again, that is present at every site throughout our systems. And they're going to ask you when you come in a few questions. You saw some of these in the video. Do you have a fever? Are you short of breath, sore throat, muscle aches, congestion, runny nose, cough, loss of taste or smell? Or have you been around anybody with COVID-19? So these, you may even be asked this more than once during your visit, but this is really just a way of us being very thorough and screening by questions as well as by temperature. And again, just to emphasize this, you are going to be seeing a lot of people in a lot of protective gear because, like for example, the screen you can see here has been installed again just to protect the staff and protect you. And these measures, I think you'll agree with me by the end, are really highly effective. Here's a waiting room. These, some of the chairs have been taken out, and Angela showed you that as well. This is outside the cath lab, and again, there's a spot for your loved one, but not a spot for lots of visitors. So we are keeping families together, but we're doing it safely. And I think I have a video I'm going to show as well, and I'll just pause for a minute and let this run.
It's John Nienhaus. I'm a nurse practitioner here at Erie Urgent Care. I just wanted to communicate out to everybody that we are doing everything that we can to keep this urgent care a safe environment during the COVID pandemic. We're having patients come into the waiting room just simply one at a time, so we only have one patient in there at a time. We're doing our COVID testing outside in the parking lot, so we do all that outside, and then we're taking respiratory patients that we see and using this single room here to keep them isolated from others in the urgent care. So just wanted to communicate that we're doing absolutely the best that we can here to keep this urgent care a safe place to come to.
Great. That's good to see. We're really focused on that. As a heart surgeon, safety is something that's constantly on my mind. The implications of proper safety protocols in my practice can't be overstated. And I've been asked to talk a little bit about risk, and I talk a lot about risk to my patients, but to talk a little bit about the risk of coming to BCH, because there is, for some people, a perceived risk of coming to see the doctor. And there are a couple of things I just wanted to make sure that I communicate to all of you. And the first thing is that every person that you encounter when you come to visit BCH is going to be focused on your well-being. And that is distinctly different from when you visit the Home Depot or King Soopers, or even if you're out on the trail or at church. There are a lot of folks out there, a lot of them are masked, But every single person you encounter when you visit one of our hospitals or clinics is going to be focused on your well-being, and I think that's a very important distinction. Every patient that comes in is screened for symptoms or tested if it's appropriate. All the staff are fully trained on the proper use of PPE, masks, gloves, eye protection. And so, again, this is unique in the community, because it doesn't take long to be at the grocery store or the laundromat and you see folks with their masks half down or none at all. And so, again, every person that you encounter has been trained on the proper use of this equipment to keep you safe. I would suggest that there's not a single place in Boulder that has greater safety and security around COVID transmission than the BCH hospitals and clinics, for the reasons that I just described. And I think it's the attention to detail, the proper training, the thoughtfulness that goes into to our care and our protocols and taking care of each other that has really allowed Boulder to succeed in many ways where other communities have struggled in containing this. And we have been exceedingly fortunate at Boulder for the never really having to reach capacity or anywhere near capacity on some of these sick patients, whereas around us, some of the other places have really struggled with some higher volumes of these folks. The other side of the coin is, what's the risk of not coming to BCH? Well, my practice is focused on heart disease, and I don't have to remind this audience, heart disease is the #1 cause of death in the United States every year. Heart disease is generally a progressive condition, meaning you get a little bit and time is not on your side. Disease tends to progress, whether it's coronary disease or valve disease. These are progressive conditions, and in order to treat them, we need to have a proper and timely diagnosis and timely treatment. Everyone knows and can understand that delays in treatment are not good for obvious reasons. And if you look at this slide, shows the echocardiograms performed around the United States during the first 14 weeks of the year or so, and you can see as soon as CMS made a recommendation to delay non-essential care, the number of diagnostic echocardiograms dropped off precipitously. And if you look at those gray bars on the left, there are, depending on what conditions you're looking for, 5 to 15% of those people have serious cardiac conditions. And when those studies dropped off there, those conditions didn't go away. There are people who went without a diagnosis or potentially a delay in diagnosis, and that has tremendous potentially negative impact on their well-being. And I'll just show you this slide really briefly, which talks about what is the risk of delayed treatment. And if you look on the right side, these are patients with early stage heart failure, and you can see the blue line and the red line are essentially superimposed, meaning that your life expectancy or your expected survival is exactly what's observed if we get the patients early. However, if you look on the left side, when patients are delayed, these are class 3 and 4 patients who have had a longer course of their disease, and their treatment may have been delayed. The mortality rate is significantly higher. So delays in treatment for heart disease have serious implications, and that's why we're focused on so much on getting you safely to your doctor and safely treated. So I would just say in conclusion, from the heart standpoint, there's really no safer place than BCH when it comes to COVID. This is a very safe place to be. Every person you meet is focused on your well-being, and I think it's safe for my family. They are treated at BCH. I think it's safe for my patients, and I think it's safe for you too. Delays in diagnosis and treatment lead to lost years of quality life, and we can safely see you and see you quickly. And I just toss up this number here, but we have a nurse navigator that can get patients in to see a heart specialist, generally within 72 hours if needed.